It is Thursday today. Normally I offer these on Wednesday, but I'm changing it up because I know some people couldn't meet at the Wednesday time. So happy Thursday. If you are new to the group, welcome. I am so glad that you are here and learning about a different way to do your therapy work that not only helps your clients, but helps you as well. Money is only one of the many benefits of therapy intensives. But if you do not know me, if you are new to this group, if you're new to watching this video, my name is Amanda. I am a licensed psychologist in Oregon. I myself am in private practice focusing on trauma work, trauma recovery, as well as couples work. So I offer both individual trauma focused intensives as well as couples intensives. So I am here today to talk with you all about when it comes to therapy intensives, how are we managing any client expectations? How are we sharing with them, what can they expect, both positive outcomes and some potentially uncomfortable physiological, emotional side effects that they might feel. And therefore, once we've kind of set some expectations, then also how do we set some goals for the therapy intensives. So if you are here live, feel free to introduce yourself in the chat. Let me know if you have questions throughout as they're coming up and as I'm talking about different things. But ultimately, I'm just going to start diving right in a little bit. So when it comes to intensives, a lot of you are interested in them because you have seen them as an alternative way to work. Hello, good to see you again. You've seen them as this alternative way to work, and it's an effective way to work. So when we think about a therapy intensive, this really does help us. I know there's so much out there these days about passive streams of income, alternative streams of income. Like therapy intensives are one of the easiest alternative streams of income that you can have, unless it's what you want to transition your entire practice to. Obviously, that's different. But again, it can really help you to just change a little bit of how you're working and what you're doing with clients. So there's this twofold piece when it comes to therapy intensives, which is, number one, you have to learn exactly what am I doing? How do I do it? How do I market it? How do I advertise it? But a lot of it actually comes to a lot of mindset work with therapy intensives as well. Because again, part of why you are in this group is you are interested in making more money, reducing the hours that you are working, and earning more for those reduced hours that you are working. And a lot of that sounds really good on paper, but then some people get nervous about that, of what does it actually mean if I'm asking someone to pay me $3,500 for a 2-day intensive or something like that. So while I will teach and while I will share some of the logistical information, I am also happy to talk through the mindset work piece, because that is so huge and so important for you to be successful in offering therapy intensives. So when it comes to, you feel good offering them as a service, you have a sense of how you want to offer them. Is that you do a 1 day that's X amount of hours, a 2-day package that's X amount of hours, some hours 1 week, some hours the next week. Once you've kind of identified the logistics of how you want to offer them, and you're talking with clients about them, and these services are up on your website, then you want to start thinking about, okay, so clients are going to start calling in. People are going to start asking questions about it. So obviously, it's time to do some psychoeducation when you get them on a phone call, or if they're asking questions over email or different things like that. And that's really important because some clients, again, know that therapy intensives exist. They know that they are a thing that is important, but what they don't feel as confident in as, so like, what should I be expecting here? And unfortunately, a lot of the times the answer is like a it depends kind of situation. But that's where, again, as much as you can talk about, from my experience, and this is, even if you haven't done therapy intensives before, you know what to expect from the therapy work that you do, the modality you're trained in, the clinical population you focus on. You have a sense of how things go. And so you can guesstimate what that's going to look like when we take that traditional 45, 50, 60-minute therapy session that happens on a weekly basis to now what's going to happen in like 3 to 4 hours when you're just sitting down with someone. So clients are looking to you as the expert. They want to know, what can I expect? Is this going to fix everything? Am I going to feel totally better after that? Because therapy intensives, they offer accelerated healing. And of course, many people are interested in that. But again, that's where we want to manage those expectations of, it's probably not the magic pill, magic bullet, quick fix, all those things. It's probably not going to be that, but that doesn't mean it's not going to be immensely helpful for you. So when you think about what clients can expect, think about for you, again, with the modalities you would plan to use, if that's for trauma, if that's for couples, if that's some kind of somatic work, what do people typically experience in the weekly model on a short-term basis? You can imagine that a lot of that is going to happen as soon as you just extend it. What I'm often telling people is, number one, you're probably going to be really, really tired afterwards, because I know even in a 20 to 30 minute EMDR or brain spotting session, or even emotionally focused couples therapy work, people are tired afterwards. So yeah, you're going to sit them down for however many hours in a day or across multiple days. They're going to be really, really tired. So that's number one that I tell a lot of people is you're probably going to be tired. But two, you want to talk about the logistical components of literally what to expect. So not just schedule-wise, like here's what we're doing, here's what you can expect. But paperwork and assessment-wise, here are the things I'm going to ask you to fill out. Here's all the logistics of when I'm going to want that paperwork back. But you need to share with them explicitly that this is a little bit of an intense process. I mean, it's literally called intensive therapy, and it's called that for a reason, but it's not like scary intensity. It's a lot of processing that you're doing in a condensed period of time. And so to be sharing with them, it requires a lot of energy, and so it requires a lot of commitment. It requires a lot of willingness to kind of do that work. And that's one of the things that I actually really like about intensives too, is that people who are looking for an intensive program, they usually are so much more committed to the therapy process and to their therapeutic goals that they are willing to do some depth-oriented work. So that's a good question. Is it Andrea or Andrea? I think it's Andrea based on the spelling. But if it takes place in the consultation versus the interview/intake. So a little bit of both, because in part, they're asking questions of, you're on the consultation call, they're asking questions of what to expect. Does this feel like a good fit for the things that I'm really needing support with? Then yeah, you can answer some of those questions there. A lot of those conversations happen in that space. Andrea, yeah, that makes more sense, thank you. So part of it is in the consultation, and then another part really is in the kind of pre-interview intake. And again, I tend to do those separate of here's my intake, and whether that's the day before, whether that's a week before, even a couple weeks before. Sorry, I just got a pop up on my screen. No, there's no web threat. Get out of here. So however long it is before, they're filling out paperwork, because even in a consultation, you do this with non-intensive therapy too, but now from the consultation, it sounded like they were a good fit. And then, right, someone fills out an intake form and you're like, okay, well, they didn't tell me that on the consultation, so that might change a lot of things. Or actually when they get into the intake session and then you start to see them, you start to kind of really see the impact versus read about it and kind of hear a little snippet of it during the consultation. So a lot of it is going to unfold in both settings. So generally, again, during the consultation, in terms of expectation management, I'm giving those pieces of, we're probably not going to get to everything you want to get to, and it's going to be tiring, and it's going to take a lot of work, and it's going to require a lot of motivation and all that. And then two, once I get their pre-intake paperwork and I'm reading through that, reading a little bit more of their history, seeing some answers on their depression, anxiety assessments, if you do any trauma assessments, like whether that's symptomatology or what's the word, like dissociative kind of assessments, like that's going to give you a lot more information. So that's where I talk with people in the intake about, based on some of the things I saw from your paperwork, based on the things that we talked about at the consultation, here's more of maybe what you can expect. So people who have had multiple traumas or relational trauma, even in the context of couples therapy, that's where I'm sharing things around like, we're probably going to go slower in this process. Like it's still going to be an intensive process. It's going to bring a lot of healing because it's still accelerated therapy, but we're going to go a little slower because we don't want to override your nervous system. We don't want to make it not feel safe. And so sharing with them, based on what I've learned, here's my clinical assessment of here's what's going to be really helpful. During that intake appointment as well, that's where I'm doing things like if someone came to me because they want to do EMDR or brain spotting, I'm also going to show them like, here's what that's actually going to look like so they can expect it. So I've had people do 5 minutes of EMDR in an intake and they've realized, I don't think I like this modality. I think this is too much and I don't like it. So then we're talking about pivoting, right? But like, that's really essential too. Like, don't wait to kind of surprise them at the point of the intensive session so that now they're doing the processing and they're feeling really uncomfortable about it. So if there's any kind of expectation management you can do in the consultation and in the intake just to show them like, here's what those interventions are going to look like and feel like, that's really good too. I saw a question and then it went away. Where did it go? Oh, I don't know where the little comments box just went. That's weird. Maybe it'll pop back up somewhere. But so yes, when you think about managing those expectations, again, show them if there is something you want to be demonstrating technique-wise. That's super helpful. Sorry if all of a sudden the chat isn't working. I don't know what's going on there. But if you do have questions, let me know. Do them on as a comment when this video posts and I'll make sure that I answer them right away. Good old Facebook having technical difficulties. So yes, you want to give them a sense of what this intervention is going to look like, and again, seeing how that's going to inform the intensive process. And two, part that you want to consider when it comes to managing expectations and setting goals is even how long do you have? Because if you've booked a 90-minute session, you're going to cover a different amount of like topics and like the scope of processing is going to be different than if you have a 4-hour intensive or if you have 3 days of 4 hours or something like that. So two, when people say, here's this list of things that I want to get through, but I only want to schedule a 3-hour intensive on one day, like again, that's where I come in with, those are all really great goals. I think there's a lot that we can do, and we may not get to everything. And we can be intentional and kind of choiceful about that of, what is the biggest thing? What's the thing that's most upsetting? And maybe we just focus in on that. Or we rank order them of what do you really want to get to? And then we can split our time between those 2-3 topics or something like that. But again, you get to be a little more